I'm Daniel Minty, a cognitive behavioral therapist, teacher, and writer. Low intensity CBT, abbreviated as LICBT, is a global movement designed to increase access to mental health care by means of training laypeople to deliver quality care for pennies on the dollar that such care usually costs. The movement began in Britain 20 years ago and has since spread to countries around the world. Studies often find that treatment outcomes for LICBT are on par with those achieved by more traditional forms of care. In January 2021, the first ever LICBT training program in the United States will launch in California's Pomona Valley. A partnership between Uncommon Good, a Pomona Valley nonprofit, and All Things CBT. The program will provide 40 hours of online training to 20 Latinx immigrant women and be divided into two parts. The first 20 hours will teach students evidence-based cognitive and behavioral tools to address anxiety and depression. The last 20 hours will focus on training students to work as community health workers or promotoras, sharing the skills they've learned with others. We'll be collecting pre and post data, both on the 40 hours of training and then on the LICBT our promotoras will eventually be offering their community. Please sit in now on my discussion of this groundbreaking program with three team members. Joining me from the Pomona Valley is Nancy Minty. From Mexico City, Victoria Chicarel. And from Jerusalem, Yehuda Bar Shalom. So thanks to each of you for joining us here this afternoon. Looking forward to our time together. And wondered, Nancy, if you'd get things rolling by telling us a little bit about the organization that you founded and direct, Uncommon Good. Your website says the mission of Uncommon Good is to empower the poor and save the planet. Tell us a bit more about what you've been up to for, is it 20 years now there in the Pomona Valley?
Well, Dan, actually, I've been working for over 40 years now with the immigrant population in Southern California at my first organization, the Inner City Law Center, and now at Uncommon Good. And some of the consistent factors that I've seen with my client community are a very high poverty rate, since they're the most newly arrived group in this country. Very high levels of trauma due to violence that they have experienced in their home countries and in the immigration journey. Very high levels of fear, anxiety, and stress due to poverty, immigration fears, and now COVID and its associated job losses and school closures for their children. And so, what we found this last year is that our already stressed population has been pushed to the brink. Recently, we've had 2 of our kids try to kill themselves. We've had a mom with a psychiatric hospitalization. We've had a child, fall victim to online predators. And it's just out of control, And the other consistent healthcare reality that I've seen over the last 40 years is that the 2 hardest forms of healthcare to obtain for our community are mental and dental. And we recently had a regional kind of convening of parent leaders in the area. And even though I know that they don't know where their next month's rent is coming from, they listed their 2 top concerns as being mental health and the failure of their kids to thrive with online learning. And I was so touched by that, because I know, in the Maslow hierarchy of needs, they should have been saying, where am I going to pay my rent? How am I going to pay my grocery bill? And no, they were saying that there were mental health concerns and their children's learning. And in California, this is a particular problem because everybody thinks that the mental health problem has been solved by the so-called billionaire tax that was passed a few years ago. But the problem is that all of that money goes to regional county providers. And the big regional county provider in our area only has 5% of its programs offered in Spanish, even though the largest city that it serves, Pomona, where most of our families come from, is 80% Spanish speaking. And so we, for this and other reasons, we and our sister nonprofits in the region have given up trying to access services through this organization because they're so powerful. They have a lock on all the money, and they just really don't care that our particular community, the community most in need because of poverty and language barriers, is going unserved. And we've also found that private foundations are deaf to our requests because they also think that the billionaire tax has solved this problem. So when I first learned from you about LICBT, I got very excited because I made a connection. And one of the programs that we have here at Uncommon Good is a parent book club, where the parents read in Spanish books that their children may be reading in school to, model reading and foster a love of reading. And the most popular book we ever offered was The Four Agreements, which is a book written by, a Mexican doctor that with a Toltec ancestry, which basically takes indigenous wisdom, indigenous Toltec wisdom, and puts it into this wisdom, I would say, is basically CBT, how not to be a victim of negative thoughts and emotions. But he's put it into a culturally accessible context for Mexicans and Latin Americans that our families just loved. And they said this book transformed their lives. And so I thought, wow, this is just CBT. And this is something that our community apparently is very open to based upon their reaction to this book. And when we told the parent community that we would be offering these classes, with you, Victoria, the classes immediately filled, all 20 spots, boom, were taken. And now we just need to find the funding to make this program really sustainable. And I think of it both as a public health issue and as a social justice issue. And I think it's a public health issue because mental health hygiene, which is what CBT is, should be taught in our schools along with reading, writing, and arithmetic, because it's that fundamental a human life skill. It's the basis really for living a happy life and solving your other problems. And I also think, as you alluded to earlier, Dan, that it's a social justice issue because if you're well-to-do, and you're in distress, you can, of course, afford care. If you're poor, you go without. And that's just the reality on the ground here. And that's what I'm so hopeful we'll be able to begin to change with you wonderful folks and this amazing pilot project.
Oh, thanks so much, Nancy, for those 40 and counting years of service to our communities most at need there in Southern California, and the heart and mind and creativity that you bring to that, making these connections between indigenous wisdom in Mexico and CBT, which we think of as an American invention, got rolling in New York City back in the 1950s or so. But as you're pointing out, is actually just part of the perennial philosophy, how we think about our life, how we act in our life, creates the meaning, for better and for worse, that we experience that life as having. So it's not surprising to me that the community there responded the way that they did. I think we get this at some very primal level, that our thinking and our behavior are perhaps the two most powerful levers we have on our experience of wellness. And like you, I certainly wish this were taught in schools. CBT has added a great deal more emotional value to my life than arithmetic ever did. But then I don't have the math gene, so.
I'll co-sign that.
Okay. Yeah, well, Victoria has graciously agreed to be our lead trainer on the project. And she has also graciously agreed to speak to us mostly in English during our time here today. I'm very grateful for both of those graciousnesses. And I wonder, Victoria, if you could share with us what your hopes are for the first portion of the program, the first 10 weeks, where you'll just be sharing the CBT tools that we've developed with these 20 students.
Okay, thank you, Daniel. Thank you for inviting me. And as I told you, I will try to speak the best I can in English. Sorry if I don't do it very well for the ones that are going to see this record, but it's a great pleasure for me to be in this project. And I want to say, first of all, that when I began to study Team CBT, when I arrived to the university with Yehuda Bashalom, that he's here with us today, and I listened what he was telling me and how was the program. I was so happy and so grateful to have the opportunity to learn that. And when I began to learn Team CBT, it changed my life. And the first experience that I had, it was not as a therapist, it was as a human being. And I have a lot of good things from that. And when you invited me to work with you with these moms, I feel very, very grateful also because I will learn a lot from them. And I know that they came, most of them in this group from Mexico, from different states of Mexico, but they have a lot of common. And I have the hope that what they are going to learn will change their life in the same way as it changed my life, no? Because I am also a human being. I have a lot of monsters in my head, and I think really that they have big teeth and that they are going to bite me. And when I began to listen to my thoughts, and I can see where they are not real, where are they with distortions, I can change my thoughts to some real thoughts, more positive. And when I say positive, it's not that it's a life from Disneyland. No, it's a real life. But when my thought is real, it doesn't hurt me. So I have this hope that this woman will have the same opportunity as I had in the university and have the opportunity to listen to their thoughts and can change them. Because when you think, first you think, and it depends what you are thinking, it's the way you feel. But if you change the way you think, you can change the way you feel and also the way you behave. So this is my great hope. The challenges are very big because we have people from different cultures. Even if they come from Mexico, they are from different states. And even if all of us speak Spanish, we have some difference in the language. So I have to see how make that everyone will talk about the same language, to unify the language. And the Team CBT seems to be very easy, but it's not so easy when we are practicing it. But I hope that they will get in love of CBT, of LICBT. And when we get in love with LICBT, it's easier to learn it, to practice it. And then when they will know how to use it in their own lives, they can share it to the community. And they can share it because they will know that it's useful and that they can really change their lives.
I think you're putting your finger on something essential, Victoria. As a therapist and teacher, I can only offer my own experience. So like you and everyone else I know, I have those monsters in my head with those big teeth and those terrible voices. So learning to befriend those monsters and to recognize that they're just an aspect of who I am enables me to live quietly with them and not have them calling the shots, but be able myself freely to choose the life and death that I want to be living and dying. I have seen you teaching at a very high level there in Mexico City. I've had the honor of co-teaching with you and Yehuda over the last years. And I've seen the professional community there, licensed therapists, respond to you as a human being and to the technology that you've been teaching in a very big and gratifying way. You're going to be providing this teaching to people who are not licensed. I'm assuming many of them have very little education. And I'm wondering how you anticipate that being different than the work that you've been doing so far.
Okay, it's a very good question. So I will say that I have a wonderful teacher just here with me, that he's working with me and coaching me, that it's you now, Daniel. And I had a wonderful teacher that is Yehuda, that is sitting here also, and that I know I can go with him if I need something. And we are doing a project, a program that is special for this kind of community, that we are really picking the methods that we think are the most important and most useful for them. And the difference is that this is a program that was made, ¿cómo se dice hecho a la medida, Yehuda?
Maybe tailor-made. Tailor-made. This program is tailored. Mm-hmm.
Yeah, for this community. And we have the core values of the method of Team CBT, but I think that we choose very precise what we want to transmit them, and that they can understand. I think that you don't have to be licensed and to be a genius to understand that. You just have to want to understand that, and you just have to have the experience to be convinced that it's useful and that can make a different your life, transform your life to a much better wellness.
I've heard it said that you learn CBT more quickly if you haven't been to college.
Yeah, I think so. In the university, we have a lot of students that fight a lot with the model, with the program, because they came from different schools of psychology, and they have a lot of resistance to change the way of thinking in the way they learned. But the people that are not licensed, they are, the mind is white. So we can learn much better. We are not fighting with any other schools of psychology,
Yeah.
and we don't have questions if is it good, can I do that? Just I learn it. I have the experience in my life, and I see that it's good and that it can transform my life. Then I can embrace it much easily.
In Zen Buddhism, we speak of the beginner's mind. And in the beginner's mind, there are many, many possibilities. It's a very open mind. It's like the mind of my grandsons, these little human beings who are just open to the whole universe. And in the expert mind, there are a few possibilities because we know already the right answer. So we just close all the other doors. So I can see that you'll be an excellent company with a community of beginning-minded students who I expect will be quite open to the wisdom that you have to share with them.
I think so, and I ask them to enjoy the program. It's not to be stressed. No, it's a program to enjoy and to have fun all together and to learn all together. And it will be very important because this will they can spread in all the community that they have a lot of need of mental health.
Yes. Well, you are an excellent role model for enjoying learning. So you'll be embodying that pleasure there at the front of the digital classroom.
Thank you, Daniel. Thank you.
Then, Ana Victoria, I wonder if we can bring in our mentor, Yuda, from whom we have both learned so much over the last years. Yuda was the person who first introduced me to low intensity CBT. I had not heard of it, but a couple of years ago, he shared some of the literature coming out of Britain, and that's how my feet were set on this path. I wonder, Yuda, if you could speak a bit about the global context for LICBT and maybe follow up on some of Nancy's thoughts about the politics and the economics behind this approach.
Yeah, thank you, Daniel. And I'm so excited to see Nancy, you, and Victoria working together on this. And I still have a relationship with Latin America as a volunteer. Whenever I'm asked, I give my opinion and help. And we do something CBT together, exams, etc. And it's always good to leave the leadership to somebody that's even better and smarter than you. So we now have Victoria leading Mexico so gracefully, and I'm so glad that you can also do this very, very special project. And your question about what Nancy spoke about before, which are these savage inequalities, which we see in many, many countries, are indeed so damaging, and they don't make sense because for example, in Britain, when David Clark from Oxford started thinking, how could we help, exactly like Nancy is asking herself, people who do not have access to psychological treatment. So Professor Clark came up with the idea, oh, we can train people who are good enough to be a sort of a lay therapist, or then becoming professional to a limited range of what he saw as an epidemic of depression and anxiety, and the results were staggering. I mean, millions and millions of people getting better treatment, and with evidence-based, as you folks are doing it in this program, or if, showing that indeed we achieve the results. And mental health is related also to physical problems, because the people with depression and anxiety end up needing also the other medical aspects of the hospital. So there was a calculation that you actually save a lot of money when you treat people with depression and anxiety. And the British example in this project that is going to be launched here are already in the line of Amartya Sen, who's an Indian philosopher and economist, that basically back in the 80s already said, let's check, and Nancy mentioned the Maslow pyramid, let's check what are the functionings that people are not getting. You know, the right to socialize with other people, to be happy, to consume culture, etc. And mental health, indeed, is one of those functionings that would make societies more equal. Also in the university in Mexico, we saw that we got some students that could hardly pay the tuition, which, I don't know, they make $10 per therapy sessions, and already then we started to struggle, and some of them with less preparation than others. So I think it brought about a lot of questions of how you tailor-made for them this technology that can make many people very happy. So I think that what Amartya Sen, the Indian economist and philosopher, established like a philosophical idea. In the fields of therapy, we have this whole concept of outreach that you, Daniel, did many years with people who suffer from addictions. And the idea is not going to Berkeley or some other school, getting your degree and opening in Palo Alto your clinic and hoping that people come and pay a lot of money, which nothing wrong with that. But what is it for us? Because mental health providers many times care about people, and their eros goes beyond the immediate community that can pay for services. So I think it is, if we want a happier society and if we want to reduce inequality, giving this access to mental health is so crucial. And Aristotle, the Greek philosopher, way back then, he was saying that the democracy that has so horrible gaps cannot last very long. So he was concerned about inequality. And I think in a true democracy, savage inequalities cannot exist. And I don't know if I have time for some more examples that come up to mind about outreach. For example, in Israel, there is an association, again, like Nancy, they all struggle to find funding always. In Britain, the case with David Clark was different because he was able to convince the Ministry of Health, oh, this has to be national. So I hope Nancy, her pilot becomes a national thing, and maybe with a new administration, there would be a feeling that programs like these, which are effective and evidence-based, need even more support. But an NGO in Israel, they have this concept of ambulances, and the ambulances are not for medical supplies. I have friends who are volunteers in those ambulances. What do? They prepare them about the realities of being youth at risk. And we know that youth at risk in certain areas, in certain towns, they hang out basically all night and do many times stuff that's dangerous, socializing with each other, but you know, they can be rowdy, they can be doing drugs, etc. So the ambulances arrive there, and they step out of these ambulances and they offer tea and cookies and whatever, and they just talk. And they are taught to be non-judgmental and just to listen. So in Team CBT, we know this is empathy and just connect. And from this, like appearing like additional alternative developmental figure there, these youth from these connections start exploring the possibility, oh, can you refer me to a mental health provider? Can you refer me to, I don't know, maybe I want to enlist to the army, which in Israel is a normative thing to do, can you enlist me back in high school? So these people become bridges to incorporate them back to a more normative way of life. So I think that is a wonderful example. And the last example I want to bring is a school in Jerusalem. I did research on 20 years ago. And in this school, when they founded it, they realized in this neighborhood, only 12% of the kids can make it to the university according to their matriculation exams. And they thought, oh, this neighborhood is full of Jews from Arab countries, and that Jews from Arab countries bring a culture which is called the Mizrahi culture, which maybe some European Jews see them as lower. So there is a bias, there's like a built-in racism, especially in the 70s and 80s and 90s. So when they opened the school, they said, we are going to make these kids very proud of their Jewish Arab lineage and heritage. And indeed, the teachers are exactly like the providers that Victoria and Nancy and Daniel, that we are going to train in that program, in the sense that they knew also how to connect in a very effective way with the students. And in a few years, from 12% success in matriculation exams, those kids went to 60%. So it's a 5 times increase because there was an outreach. Let's build a school in the community. Let's respect the culture. Let's bring in teachers who are themselves from the Jewish Arab community and respect and admire the culture. And 10 years ago, that's why I shifted professions. I went to counseling school in order to join the school and become the school counselor. So now I am back. I teach at university, but I am doing my twice a week serving these kids. And I use exactly the CBT and LICBT and Team CBT approaches, whatever works, that to offer them, offerings about how do they want to run their lives, showing them different options, and and smiling with empathy to see whatever choices they make. So the more that we do programs like this, I think we are investing in true happiness for whoever is there. I mean, what do we live for? What is the meaning of life if we don't just connect with each other and try to make this a better place? Mm-hmm.
Thanks so much, Judah, for sharing those success stories and for your many decades of work on the side of the poor and the underprivileged globally. As you were describing the school, I was thinking of Uncommon Good's Connect to College program. And it seems like there are some strong parallels between what Judah has described there and your mentoring program, Nancy. Wonder if you'd want to comment on that.
Sure, Dan. That program grew out of my years of working with the families in slum housing and winning lots of money for them and giving them, this money and telling them, go live happily ever after. And a few years later, they'd show up back on my doorstep and they'd say, Nancy, we're in another slum. Can you help us again? And I said, well, what happened? And of course, what had happened is that they had lived off the money until it ran out, and then no one had the education to keep a job, to keep them above the poverty line. So back down they went to the slums. So I said, okay, well, we can solve that. We'll, when we win a case, we'll put aside college money for the kids so that they can go to college and break that intergenerational cycle of poverty. So we did that, and the kids started turning 18 and showing up for their college money. And they'd have 2 babies and a boyfriend in jail. And I realized, oh, this isn't college money, this is diaper money. We have to start much earlier with the kids. So that was the inspiration for our education program. And we decided to start with kids in the 4th grade because at that point, they're old enough to do activities with adults who are not immediate family members, but they're not so old and jaded that their peer group is God and they don't want anything to do with adults. You know, we learned that if we waited even until middle school, you know, until they were, you know, 11 or 12, it was too late, and we would lose many of them. So we get them in the 4th grade, and then they each get a mentor, which is a person who is just kind of a friend and a confidant and a guide. And we found that power of relationship is transformative, and it really opens the child's eyes to who they could be in the world, how they could succeed in the world, what college would mean for them. It breaks through all of the kind of limitations of poverty that they may have been hampered by before. And it's also equally transformative for the mentors. You know, they become much more compassionate people who are open to the realities of the poor and the immigrant community. And so based on that relationship foundation, which is really just the power of love, you know, we then build on programs that help the child succeed in school and ultimately go to college and yes, break that intergenerational cycle of poverty through education. So I would say that it's, you know, a love-based program, but also includes many academic and cultural educational experiences too that they wouldn't otherwise get in their communities.
And who are the mentors in Connect to College?
Many of them, well, are college students. Some are retired people. Some are, you know, actually, you know, people with families of their own who want to reach out and give a hand up to a child. And increasingly, we've done more and more outreach to bring in Latinx mentors, because our community is 98, 99% Latinx that we serve. So there's that extra benefit of seeing themselves mirrored in the success of someone who comes from their culture and has some of their same experiences, but who has made it in this culture and become successful. Yeah, and the program really works. You know, about 45% of our kids' cultural or socioeconomic peers drop out of high school. And we're not even talking about go to college. They don't even finish high school. But every kid who's gone through our program has gone to college, which is astonishing. We have 100% success rate. And we tell kids that, and we don't cherry pick them at the beginning. You know, a lot of mentoring programs are successful because they cherry pick the kids that are already the good students and doing well and so on, and may be going to college no matter what happens. But we'll take any average kid and tell him or her and their family, if you do what we tell you, you're going to go to college. This is going to happen for you. You can do this. And so in that sense, you know, we joke in this country about all of the, you know, the rich politicians who went to the fancy schools, even though they were kind of, you know, let's say not mentally, you know, the sharpest tool in the shed. And so we don't think that you have to be a genius if you're a poor person to go to college. Any regular kid could have the benefit that an education could offer, and that's what we give them.
That's just magnificent, Nancy. And I think love is the word for the active ingredient in what all of you have been speaking to. This regard for ourselves and each other, for our planet. When we're acting in the direction of acknowledging that love, then I think we live pretty well. And from a CBT perspective, I think, Nancy, you're saying to these young people, do these behaviors if you want to change your experience of yourself in the world. Victoria was talking about how changing our thinking will lead to a different experience of ourself, our possibilities, our future. changing our behavior will do that too. So when you say to these young people, here's the behavior that you can emit as the behaviorist, let's say, and then you'll go to college. That's just straight CBT right there. And in our LICBT program there in the Pomona Valley, half of the methods we'll be sharing will be behavioral methods. Behavioral activation for depression, exposure for anxiety. So we'll be showing these students how to use their minds and their bodies to create their reality. And Yuda referenced India. I think CBT comes out of India, the Vedic literature, Vedanta. And so it's nothing new, because 2,000 years ago, Patanjali was writing, how you think and how you act will create your life and your death. And all that we're doing with CBT in the 21st century is bringing in some methods that we've developed that help people choose the thinking and the acting that they most want to be hanging out with. And in that way, choose the reality that they would most want to have. We have a couple of minutes left here. I'd love to just open things up if anyone else has comments they'd like to add before we say goodbye.
Yeah, I just wanted to mention that I was very excited to hear about 100% success in college and not choosing the kids that are like the natural, like the smartest, brightest, most motivated. But so I think it's a remarkable success. Another American program that came to mind is Sarah Heller's experiment. I don't know if you folks are familiar with BMN, and it was done in Chicago, and it's also CBT, an experiment on teaching urban youth different behaviors and doing exercises that I found them fascinating, like putting them in pairs, one with a clenched fist and the other, and giving them 1 minute. You have to make your friend in pair open the fist. So everybody chose this kind of strategy, and no one thought about the possibility of saying, Joe, could you open your hand for me? And then there was an analysis, why was that strategy not accessible? And then basically they said, yeah, you have to be tough in this neighborhood, etc. So the question was, okay, if you want to also interact with other neighborhoods and you want to live in other places, what is it that you could do? So there was a lot of work on that. So I think you're right on the spot, Daniel, thinking about it and then acting differently when somebody gives you an option. So yeah, I mean, there's so much stuff that can be done, and I think that the CBT tools are so effective and so to reach very good results in a shorter time. So I'm really looking forward to see what happens.
I also wanted to just express again my deep gratitude to each of you. I feel that being able to offer this to my beloved client community is really the culmination of the work that I've been trying to do in my life. And in an even much larger scale, I think that it's also the foundation for world peace. You talk about not knowing how to ask to open the hand. If we can learn how to become happy, peaceful people, there's no way that war could continue to coexist on this planet, And so I see all of your work as incredibly essential and foundational to the evolution of humanity on this planet, really. So it's so profound, and I just want to thank you and to express how very much this means to me and to all of the people here who are going to benefit from it. So thank you.
Thank you. Thank you so much. What you do is so admirable.
Well, thanks, Nancy, for those wonderful words. You have certainly been a very bright light out in front of me my whole life. And I can't imagine having steered my way without it. And more recently, Yuda and Victoria have become lights on my horizon. And I feel too very blessed to be in such excellent company. And I entirely agree, Nancy. There's talk of peace. And the reality is we are at peace. Who we really are is peace itself. And so to learn to live in that state and bring it forward into the world, into our neighborhoods, into our families, into the challenges that we're facing, the unprecedented challenges we're facing globally these days. That's why I get out of bed in the morning. That's what makes living and dying worth doing. How will we express this peace, which is who we really are? And it's not principally about changing stuff out there. It's about changing ourselves. Gandhi spoke to this point as well. Someone early in his career asked him, you go into the villages and you spin cloth with poor people. Is this a humanitarian thing? And Gandhi said, absolutely not. I don't think he ever used the words humanitarian in connection to his work. He was saying, I'm saving myself. And that, I think, is the reality. We save ourselves when we find the peace that is who we really are and bring that into the world. And the reality is our self is not separate from that world or from any being in it. So I too see CBT as being the most radical form of peace work that I know of. And excellent fellow traveler with civil disobedience, with the contemplative traditions, whether they're Christian or Jewish or Islamic or Buddhist. These are ways of peace. And each of you is a great inspiration to me to keep my feet on this path forward. So thanks so much for our time together here this afternoon. Perhaps in a couple of months when we've run the program and we have some follow-up data, we're collecting pre-post data on the training program that Victoria is leading. And we plan to conduct pre and post data on the low intensity CBT that our students will be offering in the community. And when we have some of that data in and our statistician, Julie Staples, has had a chance to analyze that a bit, perhaps we can get back together and again share what we've learned along the way, what we found out that we didn't know we would find out, what seems to work with an approach like this, what doesn't seem to work. We're breaking new ground here, and I think staying very close to the data will keep us in the real world, that world of peace and love.